Hello, everybody. Today we're going to talk about an introduction to neuroimaging, a basic interpretation of a head CT. This video is meant for medical students or young residents or anybody really who's keen on knowing neuroimaging. It's not meant to be a long video. It's just like taking bits and pieces of the important stuff to just like have an layout of what a brain CT should look like. So we're going to start off by talking about what is the head CT scan, usages of a CT, how to interpret a CT, and finally, if we have time, a step-by-step approach. Okay, so a CT scan is a form of imaging that uses ionizing radiation to take series of images in different cuts or directions. The data is then transformed into cross-section using computer programs to produce different views of the brain or whatever part of the body you want to look at, whether it's coronal, the one on the left, sagittal, the one in the middle, or axial, the one on the far right. It's basically the same technology as X-ray. You use ionizing radiation, but the emitter of the ionized radiation rotates in a cylindrical axis, and along with the computer program that helps in creating the different views that we can see and produces much, much more detail than an X-ray. So, usage of a CT scan is a non-invasive method of imaging and visualizing the body. This is basically the same as the usage of any other imaging modality, trying to get an image of the body without really opening it up. This part is not really important. The important part is this definition that, or the like analogy that most diseases fall under one of seven pathologies. It's either congenital disease, traumatic, inflammatory, neoplastic, vascular, degenerative, or miscellaneous. So basically, when you're trying to approach a pathology or case or patient, think that whatever he's experiencing, whatever the disease is, it's probably one of these seven. It's a congenital lesion, traumatic, inflammatory, whether it's an infectious lesion or non-infectious lesion, neoplastic, vascular malformation, degenerative lesion, or it's miscellaneous, which can include stuff like cysts or maybe neurotic or psychotic patients. So, interpreting a CT scan. We're going to start off by identifying the imaging modality. What am I looking at? Am I looking at a CT, an MRI, an X-ray? Is it contrast, enhanced, or plain? And what window am I looking at? And we're going to discuss what windows mean now. So this is an example of CT brain windows. Let's call them brain windows. The theory can focus on either soft tissues, bone, or the brain. So, on the far left, the one focused on now, this is a soft tissue window. You can clearly see there is not enough information, or there is not a lot of information about the brain evident in this image, but you can clearly see a lot of the soft tissue. Soft tissue of the scalp is seen clearly here. I'm moving on it with my cursor in the spotlight, and you can even see the ear pin right here. Brain, not too much information. So, next off, this is the bone window. And how did I know it's a bone window? Well, I can clearly see the bone, soft tissue, and the brain parenchyma are not well visualized. And I can even see the outer table, the inner table, the marrow in between, and even the sutures are visible right here. So this is the bone window. And finally, the most obvious and the one that most people are acquainted with, the brain window, where it's self-explanatory. You can see the brain well, you can see any of the other stuff well, except maybe the bone, but not with much detail as the bone window in the previous image. So here, one more time, three windows beside one another, the soft tissue window on the left, the bone window in the middle, and the brain window on the right. Now, next step is identifying whether it's contrast enhanced or non-contrast or plain CT. For sake of simplicity, whenever I say CT, I'm implying that it's a brain CT. This can be with any other CT, but let's just keep it at the brain CT. So take a moment to guess which one of these two is contrast enhanced. If you guess the one on the right, you are correct, and we're gonna discuss why is it contrast enhanced. First of all, the contrast material enhances on CT imaging, which it means it's bright, hyperdense. We're gonna talk about density later. uh, Normal contrast material, or sorry, in a normal brain, contrast material does not go into the brain, meaning that it's in the margins of the image. It's an extra-axial enhancement, not intra-axial. I'm not going to talk about this part a lot in this video because it's a little bit more complex, but basically, as long as the blood-brain barrier is intact, the contrast does not get into the brain. It's on the periphery of the brain. So this is contrast enhanced because, as you can see, this arrow points towards the sulci. Here is enhancement of the sulci. They are bright, they are hyperdense. Here the vessels are enhanced, as you can see in the middle arrow, and in the bottom, this arrow and this lesion, this is the falx cerebri, which separates both cerebral hemispheres, and it is also enhanced. Compare it to the plain CT, and you can clearly see the enhancement aren't seen in a plain CT. So the one on the right is contrast enhanced. Now, after we identify the imaging modality, we have to discuss the density of the scan. Density is a way, like, to say basically the brightness of the image. Okay, so this is isodense tissue. The density can either be isodense, which is like the same density or the same color, let's say, as the brain. It can be hypodense or hyperdense. So isodense normal brain tissue, this is like it's measured in Hounsfield units. Hounsfield units. Isodense tissue is basically like the grayish white color you see in a CT. Okay, so this highlighted in the orange color is isodense normal brain tissue. Okay, here's another example. The entirety of the brain, this is isodense. This is the normal color of the brain tissue. Now, let's discuss hyperdense tissue. Hyperdense is basically white. Whatever is white is hyperdense. And hyperdense tissue, for uh, simplicity, you can define it as, you can include BDCs. We call it BDCs, blood, brain, and calcium. Blood is hyperdense, bone is hyperdense, and calcium is hyperdense. So, hyperdense, sorry, I forgot to mention it. In the bottom of the screen, you can see hyperdense will be highlighted in red and isodense tissue will be highlighted in orange. So, for example, this is bone, hyperdense. This hyperdense part right here, pointed by the red arrow, this is a calcified choroid plexus. Choroid plexus is the part within the ventricles that produces the CSF, and sometimes it can be calcified. This is completely normal. As you can see, it's a calcified choroid plexus, and all the orange arrows point towards the normal isodense brain tissue. And this part right here, we're going to talk about, this is a hematoma. So an extradural hematoma, actually, and we're going to discuss later how we found that out. So basically, hyperdense tissue, B, B, and C, blood, bone, and calcium. Here, one more time. Calcium, this is a calcified pineal gland. And these white hyperdense structures are calcified choroid plexuses. So finally, we talk about hypodense tissue. Hypodense is basically black, dark black. This is the part, I'm sorry, hypodense tissue is basically black. I'm not going to get into a lot of details on it. So hyperdense is white, hypodense is black or dark color, and isodense is the normal brain tissue or color in between. Hypodense tissue is basically fluid, whether it's CSF, cysts, or chronic lesions. And that is because chronic lesions are commonly filled with fluid. So you can clearly see these are the normal ventricles of the brain, and they are hypodense because they are full of CSF, and that is fluid. You can see it here, and you can see it here. This, for example, the red highlighted lesion, this is a cyst. It's hypodense. Let me go back a second. Okay, yeah, it's hypodense, suggesting that it's a fluid, and it looks like a cyst, so it is probably a cyst. And in this image, the purple or pink highlighted material, this is a chronic subdural hematoma. One more time, we're going to discuss it in another video, but chronic subdural hematoma are chronic lesions implied by their name, and they usually turn hypodense. Yeah, I'm just discussing in this part. We're just going to skip it. Now we have to identify major structures within the CT scan, and this is just like for an introductory level, so you have an idea where your head is from your feet. First off, the cerebellum and cerebellum, very basic imaging. The cerebellum is divided into frontal lobe, parietal lobe, occipital, temporal, and the cerebellum. Some people like to be all classy and say, well, we actually have a fifth cerebral lobe. It's called the insula. And you basically, it's a part of or a section of gray matter embedded within the brain. You can reach it by opening the sylvian fissure, which is right here, and looking deep, you'll find some gray matter. This is the the insula. Here are the brain regions highlighted on a CT scan. This is the frontal lobe, and here is the parietal lobe. The cuts keep going down, further down. Here is the frontal lobe, parietal lobe, and the occipital lobe starts to appear. The further down we go into our cuts, we have the frontal lobe, the temporal lobe. Here is the cerebellum. And how do we know it's a cerebellum? Well, you can see here along, like if you follow my cursor, I hope it's visible. There's like a hyperdense, a small white line moving here. And this is the midbrain. We're going to discuss it later. This is the tentorium cerebelli. And once you see it, means we started reaching the cerebellum. So this is the cerebellum. So after that, we're going to talk about the ventricular system. So this is the ventricular system. You start with the lateral ventricles. We have two lateral ventricles. Then the lateral ventricles drain the CSF into the third ventricle through the foramen of Monro, right here. From the third ventricle, the CSF moves into the fourth ventricle through the cerebral aqueduct of Sylvius. And from the fourth ventricle, it exits into the subarachnoid space in the spinal cord and the brain, surrounding the brain, through the foramen of Magendie and the foramina of Luschka, but they are not apparent in this image. So here is an MRI scan of the brain. This is about CTs, but if you want to look at the ventricular system, an MRI is perfect for this. This is a T1 weighted image MRI. How did I know that? Not in this video, but basically anything fluidy, any fluid is black or dark signal, as we call it on an MRI. So all of the white structures are solid or mixed, and all of the black structures are fluid. So if you look here, this is the corpus callosum, following my cursor right here. And from here, we start the lateral ventricle. It moves down into the third ventricle right here. And you can see a very small slit moving the dark fluid into the fourth ventricle. This is the aqueduct of Sylvius, and this is the fourth ventricle. So yeah, oh, it's actually labeled. I forgot. This is the lateral ventricle, foramen of Monro. Here is the third ventricle. Here is the aqueduct of Sylvius, and this is the fourth ventricle. And this is the foramen of Magendie. Now we're going to move on to the basal ganglia. Here is an axial image on the left and a coronal image on the right. This is the caudate nucleus. It's lateral to the ventricle, the white part right here. This is the ventricle. This is the frontal horn of the lateral ventricle. And I'm not going to get into details, but maybe in another video. This is the head of the caudate nucleus. This is the putamen, highlighted in red. The thalamus, highlighted in green. The globus pallidus, it has an external segment and internal segment. Both of these are also part of the basal ganglia. And I drew this on the diagram in the pink color. This is the internal capsule. So the internal capsule, if you're looking at an axial view of the brain, you can see at this level, the basal ganglia, the head of the caudate nucleus, lateral to the frontal horn of the lateral ventricle. You look back a little bit, and here's the thalamus. Right to the lateral to it is the putamen, and in between them, the internal capsule, where most fibers, motor sensory fibers of the cortex pass to reach the body. And I highlighted the ventricles in blue so you can distinguish all of these from one another. And in pink is the third ventricle. It's not really important here. So let's skip the slide. Okay, as you can see here, this is an CT scan. This is a plain CT scan we're looking through the brain window into an axial image at the level of the, I'm not going to discuss levels in the video, but for sake of this example, this is the level of the basal ganglia. And how did I know? Here, both of these are the frontal horns of the lateral ventricles. Wait. Both of these hypodense or black structures are the frontal horns of the lateral ventricle. As you can see, there's a hyperdense or white part just lateral to the frontal horn. This part highlighted orange is the caudate nucleus, head of the caudate nucleus. Now, take one more look to the right, and the part highlighted in red is the lentiform nucleus. And following this trend, the hyperdense segment right here is the thalamus, and between them is the internal capsule. This is very important when you're looking at a patient with strokes, because strokes can happen in multiple locations, but they happen a lot in the internal capsule. And the internal capsule is a very tight spot where even a very minor bleed can compress and cause a mass effect on a lot of motor and sensory nerves. Here it is one more time. Try to do it for yourself. I'll give you a second to look. Identify the head of the caudate, planiform nucleus, and the thalamus with the internal capsule between the three structures. So here's the head of the caudate, here is the lineaform nucleus, and here is the thalamus and the internal capsule in between. One more time. I don't know what the slide is, but okay. No, sorry. Let's just skip that part. Okay, this is like just a plain non-labeled head CT or brain CT. So you can just take a look at what we discussed. The ventricles, out of the caudate, thalamus, and lineaform nucleus with the internal capsule in between. I hope you can see it properly. It's very visible in this CT scan. Yeah. Finally, we're going to talk about the brainstem. The brainstem is divided into three parts: the midbrain, seen right here in pale blue, the pons in pink, and the medulla in purple. Here is a CT scan. Once again, axial CT scan, brain window, plane. The midbrain, has a very specific shape. It has something called a Mickey Mouse appearance. So you can clearly, if you look here, you can clearly see it here. Here is the midbrain looking like Mickey Mouse, and it's highlighted in pale blue. You go deeper down in the cuts, and you start seeing the pons right here, highlighted in red. And if you go down even further, you start seeing the medulla, highlighted in purple. So once again, for left, this is the midbrain, pons in the middle, medulla on the right. In these cuts, if you forget, it CT keeps going down from the top of your head to the bottom of your head, starting, or you can say from the top of your head to your neck. This is the progression. And one more time, MRI, we're not discussing MRIs, but MRIs show way more details than CT. You can see here the midbrain right here. This is a sagittal MRI. We're looking at a cut through the sagittal suture. Here is the midbrain on top. Here's the pons in the middle and the medulla on the bottom. And now we're going to highlight it. Midbrain, pons, medulla. And yeah, that's it for everything. I hope this video was informative. If you liked it, let me know. We can expand on the series, put more details, start adding, like I mentioned in the beginning, a step-by-step approach, and maybe a video on pathologies and how to manage them briefly and talk about them. And thank you.